my favorite thing about working in healthcare is the people. This industry brings together brilliant, highly motivated individuals who are driven by the opportunity to make a difference. My name is Hallie Tecco, and this is The Heart of Healthcare, a podcast where I'll be introducing you to the people on the ground moving the needle in public health and medicine.
Dr. Li Wenliang went from treating patients to becoming one. The 34-year-old ophthalmologist diagnosed Saturday with the Wuhan coronavirus. It was back in late December when Li first warned friends on WeChat about a SARS-like disease going around.
The death toll from coronavirus has doubled to 6 as the number of confirmed cases soars to some 300.
If the virus turns out to be readily transmissible from human to human, there are laboratories around the world already working on really good diagnostic tests, and we've already started to work on a vaccine in the event that's necessary.
Now to growing concerns about the deadly coronavirus officially hitting the U.S.
Tonight, the first doses of Pfizer's coronavirus vaccine are on the move across the U.S.
Tonight, as the Delta variant wreaks havoc nationwide, COVID cases now rising in every state, pushing many hospitals into crisis mode.
The first case of COVID-19 was identified in Wuhan, China in December 2019. Despite early warnings from medical experts, within weeks it had spread globally, creating panic and changing lives around the world. Since then, we have locked down, socially distanced, masked up, and are now getting vaccinated in hopes of reducing the spread of COVID-19 and returning to a new normal. As of the recording of this podcast, there have been over 200 million confirmed cases and more than 4.3 million deaths worldwide. Today, I'll be talking with Dr. Charity Dean. As the Assistant Director for the California Department of Public Health, she was one of the first people in the U.S. to ring the alarm on COVID-19. While others in government denied the threat of COVID or thought it would be over in spring, she did the math and knew where we were headed. Dr. Dean served as a key member of California State's executive team, directing the outbreak response from the high-level overview to tactical operations to co-founding and leading the testing task force. She's the heroine of Michael Lewis's new book about the pandemic, The Premonition. And Dr. Dean recently left the public sector to start a company, the Public Health Company, where she serves as co-founder, CEO, and chairwoman. Dr. Dean, welcome to the Heart of Healthcare.
My pleasure.
So you were part of a small group of doctors and scientists who sounded the pandemic alarm in early 2020, but were largely ignored. You were even told not to use the word pandemic because it could scare people. I just can't imagine how maddening that level of gaslighting was. Tell us about this experience.
Sure. Well, January was an incredibly stressful month. In January of 2020, I had felt something was coming and that something had even started already in December. And I didn't know what it was, but it was such a strong sense. And the picture in my mind was a giant blue tsunami that was going to sweep in to California and move me into a different job and stretch all of my skill sets and overwhelm the state. And I didn't know what it was. And so in January, as I started watching the reports coming out of China, and by reports, I mean sketchy social media postings, news articles that appeared that China was not disclosing real numbers. That kind of information is incredibly helpful to a disease controller because we are trained to look at impartial, incomplete, potentially bad data and glean what intelligence we can. And so that's exactly what I was doing in January. the prediction of what's going to happen in communicable disease does not require any kind of premonition. It does not require a crystal ball. It's simply scraping intelligence and putting together assumptions, mathematical assumptions of the epidemiological attributes of the pathogen, and doing what I call long math on a whiteboard to project forward the outcome over time using those mathematical assumptions for the pathogen. And so that's what I was doing in January. Any way I sliced it, it was bad, because no matter what attributes I gave to the pathogen, in other words, if you assign an R naught of 2.5, of 2.2, of 2.0, either way, that is exponential growth. So I was quite anxious and became an evangelist to anyone who would listen in state government, that the math indicated this was a pandemic, regardless of how you did the math. However, for those who are not seasoned disease controllers and don't have that combination of instinct and familiarity with how to long math an epi curve, it's really hard for them to grasp the concept of exponential growth. And it's really hard to imagine that this could truly be a pandemic when everything was quiet. But disease controllers know, and I knew from being on the front lines for many years, it's always quiet in the beginning. So you cannot trust how quiet things are. You cannot trust how worried or not worried people are. You have to trust the math. Math does not lie.
How did it feel when you were waving your flag and showing your work, yet not being listened to and told not to use the word pandemic?
It was frustrating, but I also have always seen my job as a local health officer or as a state health officer as it's my duty to explain to others in simple terms what the situation is. And if they don't understand, it is not their fault, it's mine. I need to try again and explain it in a different way, because I cannot expect someone else who doesn't have multiple degrees in microbiology and communicable disease to instantly grasp the concepts. And so I tried again in numerous different ways to get the message across. I was so frustrated by the end of January, I had started to question my own sanity. I had started to question, am I the crazy person? Because this is just math and microbiology. You can't argue with the math. And at one point I spent an hour long mathing out the epidemiological curve on my whiteboard. And then I went and got our CFO and I pulled him in and I said, you're a numbers guy. Check my math. Am I crazy? And I said, so assume a R naught of 2.5, a case fatality rate of 1%, a hospitalization rate of 10%. Assume, an infectious period of this, an incubation period of that. I showed him all my assumptions. And then I said, check my math. And he stood there with his little calculator, checking my math. And after 20 minutes, he said, oh my God, this is right. And I was so relieved just to have someone else say the math was right. And then he stood back and looked at the curve and said, oh my God. And it was the first time that someone else had validated I wasn't crazy, but it was simply validating the math. And so in other words, when you show another human who trusts the math, whether or not they understand the microbiology is irrelevant, because this is just math and microbiology. And so truly, even leading up into early February, before I met the Wolverines, I was discouraged. I was told to stop using the word pandemic, that I was scaring people. And so I would long math the epi curve on my whiteboard at home and obsessively track any news I could scrape coming out of China or the surrounding countries, because there was zero doubt in my mind that this was the thing I had felt coming. And not only was it already here, but that because of air travel into California, indeed, community spread was already happening all around me in the state. And yet I was powerless to sound any alarm for standing up an operational plan for testing in California. So I was deeply discouraged. I was hopeless. I was so anxious. I wasn't sleeping. I wasn't eating. I developed a cardiac arrhythmia from the stress. And I was a mess. I was a ball
Yeah.
of nerves because as a disease controller, what I do, this is my containment is my favorite game. And I'm a horrible loser and I only like to win. And yet here I was unable to do the thing that I had trained my whole life to do. And here it was, the Super Bowl moment of a disease controller's life. And I had been benched.
Wow. So, had they listened and had we taken this seriously and prevented the spread of COVID, everyone would have said, oh, Dr. Dean was crazy. She overblew this. But I bet you would prefer that that would have been the outcome versus them not listening to you and you having to feel like, I told you so.
Well, I just wanted a shot. I just wanted to
Yeah.
try. I've tried and failed to contain things before, and that's always really hard for me because I like winning. But I just wanted to try, and I never blame people. I think it's really important that we don't assign blame to people who didn't listen or didn't understand, because it's really hard for humans to grasp exponential growth. And for people who are not microbiologists, it's hard to explain those concepts. And so I would put the blame on the system that relied on individual human vigilance. That's the problem here, not necessarily the people who didn't understand the threat in the beginning. In other words, what I'm focused on right now is how do we build a system that is not reliant on one individual human vigilance or one individual's bravery? How do we build a system that's resilient with checks and balances so that that doesn't happen again?
Okay, so we have this public asset, literally called the Center for Disease Control, yet a lot of the projects that came about were more guerrilla tactics from volunteer groups or nonprofits. What do you make of that it wasn't our government that led in stopping COVID?
I think that's a really great point, because the Centers for Disease Control is an institution, and it's very much an academic institution that does a fantastic job of being 100% certain and publishing summaries of what happened in retrospect. But they are not front lines operational battlefield commanders who make hard decisions in the moment to win the war in the fog of war. And so I think the point you make is important, because what happened in the early days of COVID is, in the absence of any institution or person in the country stepping in to lead incident command, or, to take charge and say, this is what we're doing and this is why, and to have the legal authority to do that, what happened is we saw these heroic efforts from nonprofit groups, from volunteers, from the private sector, who realized around March and April that no one was coming to save us, and they stood up their own efforts. And I think that actually gives me a ton of hope. It gives me hope because the American people did not fail. It was our institutions that failed. And I think a shining success story, if there are any, a shining success story of this pandemic was the amazing volunteer efforts of the private sector and the nonprofits and volunteers. And the Wolverines is just one example. There are many others. What I saw from March forward is many of the efforts pulled together with bubblegum and duct tape by amazing volunteers thought it was short term. They thought, oh, well, we're going to pull this together just for March or just for April, but the government will come and save us. Someone will come in and take over and say, thanks for starting this. We got this now. We'll take it from here. It reminded me of when I was running the Tomaszewski Hep C investigation, which was actually turning into a federal investigation with multiple states, multiple federal agencies, multiple authorities involved. And I kept thinking, at some point, the FDA or the Attorney General is going to step in and say, Dr. Dean, we got it. We'll take it from here. And so what was remarkable is that throughout this pandemic, CEOs, private sector, nonprofits, they all experienced what I had experienced, which is no one's coming to save you. Stand up in effort and don't assume that someone will come in and say, we got it from here. You might be fighting alone indefinitely. And so round up the troops, find the people that are going to fight with you, because it's very possible that that is the battle, that you are the ones. So grab whatever weapons you can find, because you're going to be in this for the long haul. And indeed, many of those groups are still operating today. And what we've seen is the CDC has come to rely on them and the data that they've gathered and the solutions they've put together. And what started out as a band of misfit volunteers has actually turned into part of the strategic response of the United States. And that's why I say our people didn't fail, our institutions did. And that gives me a lot of hope that we can put together institutional framework solutions for the country, because we do have the resilient people that will rally to the cause. They already have.
So do you think that there could be another COVID-like outbreak, or do you think that these people have figured out how to set up that infrastructure and improve the systems to manage a future pandemic?
Well, I'm pausing because I think what I really want to do is ask you. So can I turn the question around and just say, have you seen any systems changes or new infrastructure stood up? Because I haven't. Is there something that you've seen that makes you ask that question? And then I'm just curious to hear your answer, and then I'll give you mine.
Well, I know that vaccinefinder.org was handed over. The keys were handed over. So that is now vaccinefinder.gov. So on kind of the vaccine side of things, certainly in terms of testing, I think there are probably more national protocols for rolling out testing quickly and efficiently and having those lines of communication between the counties, the states, and the federal government. But, I don't know. I'm really not sure. And it does worry me that if the next pandemic had a higher case fatality rate, or if it would impact children in a way that was worse than COVID was, I'm not that confident in the U.S.
So that's really helpful to hear. I love talking with people who were not inside the government response and just hearing their feelings and processing and worries about the future. You're exactly right. Because this pathogen did not kill children, and because the case fatality rate appears to be lower than 1%, although still substantially higher than what we would see in other pathogens, the truth is we got lucky in many regards that this pathogen was not worse. And what I'm worried about is a pathogen like we saw in 1918, where it killed young children and killed young, healthy people in the 20 to 40-year-old age range. And that's what I believe is coming. In fact, there's no doubt in my mind. So to answer your question, we do not yet have the system solutions for the United States that are needed to rapidly detect and contain a novel pathogen. Despite the heroic efforts that have been put together for COVID, those efforts are still duct taping together a solution to address the immediate need. And the larger solution for the country, I would put in 4 different buckets of system solutions. And that is the need for an intelligence infrastructure that does not currently exist, using technology that we have seen revolutionize other sectors, the need for an operational disease containment infrastructure that does not exist, because the CDC does not do frontlines operational disease containment, the need for an authority infrastructure so that there's an actual lever to pull that's attached to states and localities, and then the need to reestablish trust, because the American people have lost trust in the institutions that exist. And it's time to take a really hard look in the mirror and say, how do we build system solutions that can win the trust of the American people so that next time there's a battle, they will follow the leadership and they will have trust in the system solutions that we've put in place? Because I do not believe that right now, today, the American people have faith in the CDC, have faith in public health, whether it's state or local. I think that the loss of trust from the American public is a really important breakage point that must be addressed if we're going to contain the next one.
We'll be right back after the break.
Has your chronic illness made it difficult to continue working in the traditional way? Want to learn how to find and create flexible remote work that both accommodates your chronic illness and generates an income? Join the Patients Getting Paid membership, a community of chronicpreneurs where people just like you find workshops and trainings, weekly updated condition-specific gigs, twice monthly coaching calls, co-workings, accountability, and the kindest community to support you on your path to make money while working from anywhere and taking good care of yourself. Learn more or join us at patientsgettingpaid.com.
So switching gears, one of my favorite stories about you is that you conducted a postmortem in a parking lot with a pair of garden shears because the local coroner was too scared to extract a lung that might be infected with TB. And you told Michael Lewis, and I quote, "They think my spirit animal is a bunny, but it's a fucking dragon." Tell me a little bit about yourself and how you became a dragon.
Well, am I allowed to curse on this podcast?
Yes.
Oh, I didn't know that. Oh, fantastic. Well, my goal for 2020 was to stop cursing. So I definitely picked the wrong year. You know, that quote is funny that he put it in the book. I had no idea which stories would be in the book. I told Michael probably 200 different stories from frontline disease control. And that particular story of opening up that patient's chest and extracting the lung was just another day in the life of a local health officer. It wasn't that unusual to me because I had to do things all the time that were super gnarly and messy and risky. And you just develop a muscle memory of doing it, of doing the thing that needs to be done. You don't think about it, you wash your hands and you move on. And there's no shortcut to developing courage or to becoming a brave, resilient person. You know, many people say, oh, I want to be courageous, or I want to be brave, or I want to be bold. But if they knew how you get that way, they would never aspire to it. Because the truth is, you become brave by having to overcome hurdles personally over and over and over. And the things I've gone through in my life, I call face down in the dirt moments, where I find myself losing everything, totally in despair. It feels like my life is over and I've totally failed. I'm face down in the dirt. And then comes the decision of how long am I going to stay face down in the dirt? And am I going to rise? Am I going to push myself up, get back up on my knees, and slowly start to do the hard work of getting back up on my feet? And it's a decision that we make in that moment. And Michael tells the story in medical school when my first husband decided that he wasn't sticking around if I was really serious about becoming a doctor. And that was a face down in the dirt moment. And I could have collapsed. I could have quit medical school. I could have gone a number of different ways. It was a real gut check. And I decided to just pull my shit together and just never, never, never give up. And it's happened again to me 2 or 3 times throughout my life. And what comes out of that is a muscle memory of resilience, a muscle memory of just never fucking giving up. Never, no matter what. And 25 years later, after having gone through those scenarios in my personal life over and over, it translates into disease control. I just never give up. And it doesn't occur to me that it's brave or unusual. It just becomes the way I navigate the world. And so Michael found many of those stories fascinating and interesting. But to me, it was just another day, because that's just how I run disease control.
Well, it's great that emerging women leaders have you to look up to, because too often we're expected to fit the mold of being that bunny and being soft and sweet and meek. And if those are the only expectations of you and those are your only role models, it's hard to do something new. So thank you for being a dragon. I think it's great for women to see role models like yourself. So you've spent your entire career in the public sector, and public health initiatives are generally nonprofit or public endeavors, yet you just raised $8 million in venture capital for your for-profit startup. I'm dying to know what led you to leave the public sector and start the public health company.
It was a process of becoming convinced by May of 2020 that government could not fix this alone, but capitalism and the private sector and the kind of technology developed in Silicon Valley could. And trust me, if there had been any other way to build the technology platform that needed to exist inside government, I would have done it. And I had this dream for years and had thought about the kind of platform that needed to exist to take disease control manual operations and put them in software in a way that the private sector would have the same access to disease control expertise that the public sector did. I had dreamed about it for years. And what surprised me by May was that CEOs of large corporate enterprise were learning the same lesson I had, that no one was coming to save them, that they were on their own. And as I watched that pattern develop, I realized the technology solutions that the United States of America needs right now in this moment are going to have to come from Silicon Valley. Now, I had pictured myself as a public servant my whole career. I still think of myself as one. Our company is very much has the heart of a public servant because that's who I am and that's what our values are. However, the solutions that are needed have to come from Silicon Valley. And the beauty of a private company that is venture backed is we have a back pressure to show how we have a return on investment for our clients. We have a back pressure to actually show how we prevent disease through our solutions, that we can successfully manage the risk of infectious disease for clients. Government does not have that back pressure. Let me give you an example. As a local health officer running communicable disease outbreaks, if I chose the sins of omission that Michael describes in the book, or if I chose to do nothing and pretend like an outbreak wasn't happening, then months later I could say, oh, what a shame. We never had a shot at containment. We couldn't stop it. No one was tracking my outcomes and holding me accountable for being brave in the beginning. In a private company where we're building the technology platform and serving private clients, we actually have an obligation to demonstrate why this works, how it works, to quantify that, to show how using the public health company is actually protecting their revenue streams, is keeping their employees safe, is generating public trust. We have an obligation to show that. And so ironically, a private company that's venture backed with private clients is going to be able to demonstrate return on investment for disease control the way that government has not historically done that. And that makes me excited. So truly, my motivation for launching the company is this is what the United States of America needs right now. And if I have committed my life to serving communities and protecting the country, that means I have to leave government, infiltrate Silicon Valley, start a technology company, and start building the solutions. And I fought it initially. For 2 months, I wrestled with this. And it was Todd Park who convinced me that if someone is going to build this kind of solution for the country, for the world, shouldn't it be a local health officer? Shouldn't it be someone who's been a frontline disease controller and truly understands the system from the frontline view to the state view to the national view? And then he said, I'll do it with you. I'll help you. And so he has very much been my thought partner. He's on my board of directors and has been since last August. And my inspiration that this is absolutely what the country needs, and I'm the one to do it. And so we're doing it.
So let's talk a little bit about Public Health Company. You refer to it as public health as a service. What does that mean? Tell us about the actual product.
Sure. Well, we think we're really funny. That's kind of a nerdy public health technology
Very
joke,
nerdy.
right?
Yes.
Because everyone knows SaaS, the term SaaS in the technology sector. And so we think it's a funny spin on SaaS. We call it FAS, which is public health as a service, which implies that really we are a public health technology company. We are putting public health tools into a technology platform as a tech-enabled service and providing that service to our clients. And so what that means is that a tech-enabled service that provides public health, infectious disease risk management provides a solution for the client that involves the world's best thinkers in communicable disease control. We have amazing mathematicians and data scientists. In fact, David Dinnerman and Josh Batson from the book, The Premonition, have both joined the company full-time. And Carter Mesher and Joe DeRisi are both advisors to the company. So we're taking the very best thinking of those of us that have done this for many years and putting it into software solutions for our clients. Public health as a service, like I said, we think we're funny. We've invented that term, but it's actually a legitimate term. It's a tech-enabled service that's offering public health solutions to clients.
So you made the jump from being a government official to a Silicon Valley startup CEO. What lessons have translated and what new things have you learned that you wish you had known when you were in government?
Well, in the beginning, I was not sure if my skill set would transfer. And over the last year, I've been somewhat relieved to discover that it's all the same, that hard work and being willing to do whatever it takes. In other words, the same way I ran disease control outbreaks, I really hate losing. I really like winning, and I'll stop at nothing. It actually turns out that's what it takes to be a startup CEO. I just never fucking give up. And I learned something if I don't know it. I've learned all kinds of things this last year about how to build the kind of architecture that this platform will need, how to interface with private sector clients and really listen to what their needs are. I've learned business. I've learned how to build a company, how to recruit amazing rock stars. All of that comes down to hard work, resilience, never giving up, being brave, and risk taking. I love the calculated risk of communicable disease control. And as it turns out, in startup land, risk taking, learning to be really loose and unattached to how this is going to work, but super aggressive in pursuing it, that has been the key this first year.
And so now that people are back at work, of course, there will be some people that will continue to be remote, but people are back at the office. The concerns have lifted in a lot of ways, but I'm sure you're already thinking about the next step for people and where companies really need to be on alert. Can you talk to us a little bit about kind of what's next now that we're back at the office?
Definitely. And it's an important question globally, because in the United States, because of the successful vaccine rollout, and many communities are really ramping up vaccinations. And, areas like the Bay Area have a majority of adults vaccinated. It feels safe, and it is safe to go back to work in many cases. However, the emergence of new variants is going to continue. And if you're tracking the Delta variant, some of the studies coming out about the Delta variant, then you know that that variant is much more transmissible than the wild type or the original COVID virus. And as these variants emerge, each COVID variant has different attributes. Remember, I talked about mathing out the attributes back in January 2020. In other words, some of them have a component of vaccine escape, even if it's small, and it's different for different vaccines. Some of them are going to have a higher degree of transmissibility. We watch carefully to see if any of them are more virulent, meaning they cause people to get sicker, or they cause a greater percentage of people to be hospitalized or die. And so, although right now I'm very encouraged to see the high vaccination rates in the US and that people are going back to the office, it's going to be really important that employers have access to disease forecasting intelligence that shows them what is coming on the horizon. Are there new variants that they need to be concerned about? I'll give an example of the Delta variant. We know that the Delta variant is now spreading in communities in the United States, and of course, spreading in communities that have a lower vaccination rate. And what does that mean for employers that have employees back in the office? They may have decided everyone's coming back in the office and we don't need to have twice a week surveillance testing with rapid antigen tests, for example. If they are watching the variants merging or the variants moving in the community, and if they are keeping an eye on the rise of the Delta variant and understand that it's more transmissible, there may be a point where they look at their employees who either are not vaccinated or could not be vaccinated or are severely immunocompromised, have underlying health conditions, and recognize that the risk to those employees has increased and that those employees need to work remotely for a period of time, or other measures need to be taken, like they may need to re-implement twice weekly rapid antigen testing for employees who are unvaccinated. And so there are those are just some examples, but there are a number of data points that employers that have people back in the office should be watching. And again, this is the utility of the public health company. Employers don't want to go get a degree in microbiology and epidemiology and mathematics and model out the trajectory of variants with different attributes and their rate of transmission. Maybe they do. Maybe they do. Many have become experts during this pandemic. But
if they're a biotech company, maybe.
Yes. If they're a biotech, maybe they do.
Yes.
I would guess that kind of bioinformatics, mathematical modeling, and microbiology and disease forecasting is something they would rather outsource. And they would rather say, I'm going to let the world's best experts do that for me. And I'm going to let them tell me when a risk is growing and what I need to do to protect my business.
So how can listeners learn more about the public health company if they want to become employees or customers?
If people want to learn more about the public health company, they can go to our website at phc.health, and they can see the different sectors that we serve. They can learn more about our team members. We have white papers posted on our website that talk more about genomic epidemiology and talk more about some of the technical tools that we use and how we see the future of public health. And we would love to hear from people. They can fill out a form on our website and send us a message, whether they're just curious about what we're up to or they're interested in exploring potentially using our services.
Amazing. Well, thank you so much for your time today. I'm excited to stay in touch and see as your new company unfolds. Thank you, Dr. Dean.
You're welcome. My pleasure.
Thank you for listening to the Heart of Healthcare podcast. If you liked today's show, be sure to subscribe, leave a review, follow us on social, and tell all your friends to listen. The Heart of Healthcare with Hallie Tecco is a product of OffScrip Media. Our executive producers are Holly Tecco and Matthew Zachary. Our senior producers are Brianna Seeley and Andrew McDowell. It is mixed and edited by Brianna Seeley. Our music is by Utah. For advertising and media inquiries, email media@offscrip.com. Hit us up at contact@offscrip.com to share comments, feedback, and make recommendations. For more information, visit offscrip.com. That's offscrip, no T.com.